In the arterial or vascular system, we have two important topics. That is, there are two key components that we need to know in order to understand hypertension and blood pressure. One is arteriolar compliance and the other is arteriolar resistance. The second and important factor present in the arterial system is arteriolar resistance. Arteriolar resistance is where the blood outflow is regulated. So essentially our arterioles, which are located at the end of the arterial system or at the output of the arterial system, play a regulatory role, and the increase or decrease in resistance that occurs at the level of the arterioles can regulate the amount of blood present in the arterial system. If arteriolar resistance decreases, meaning the resistance is reduced, it causes the arterial system to empty of blood very quickly and the pressure to drop. But if arteriolar resistance increases, now due to various factors such as the sympathetic system and different medications that are administered, arteriolar resistance at the level of the arterioles increases. Therefore, blood is drained from the arterial system more slowly at a lower speed and in a smaller amount. Our arterioles are like a water faucet connected to a water tank. The more we open the faucet, the faster the water tank is emptied. The greater the arteriolar resistance, the less blood is released. The pressure inside the arterial system is higher, and the hormonal and neural factors we have, meaning hormones and neurological factors like the sympathetic and parasympathetic systems, have their greatest effect on controlling, or in other words, increasing or decreasing blood pressure at the level of these very arterioles. By increasing or decreasing arteriolar resistance, they can raise or lower blood pressure. Just think of a garden hose that you're using to water the garden. The water flow is controlled by the tips of our fingers. That is, by pressing with our thumb, we can increase or decrease the water output. The function of the arteriole is exactly like the function of our finger. The harder we press our finger, the more resistance we create at the outlet, so less water comes out of the hose. But the pressure inside the hose increases. Therefore, in our arterial or vascular system, we have two important factors. That is, there are two important components that we need to know to understand hypertension and blood pressure. One is arteriolar compliance and the other is arteriolar resistance. Arteriolar compliance refers to the flexibility of the vessel walls, which allows the vessels to expand and prevents blood pressure from rising too high. And arteriolar resistance is the output of the arterial system. The higher the arteriolar resistance, the less blood flows out. We can also compare the function of the arterial system to a shower head. A shower head has a series of holes from which water flows out. On our head, these holes are like the arterioles. The narrower they are, the less water falls on our head. But the pressure inside the shower pipe increases. The water that enters the shower pipe from the faucet represents the heart and cardiac output, and the blood that enters the arterial system, meaning the greater the cardiac output, the more blood enters the arterial system, causes blood pressure to rise. Similarly, the more water that enters the shower pipe, the higher the pressure inside the shower will be,